All right. Hello, everyone. Thank you so much for joining us. I am Dr. Sophia Dorton-Cottle with Bull City Psychotherapy and Queen City Healthy Sex and Relationships. And I am happy to be here on this podcast with my friend and colleague, Dr. Frances Joy. And we are going to be having a really relaxed and organic, fun conversation about codependency and addiction. And we're going to see where that takes us. And so, welcome to everybody. Welcome, Frances. I'm so happy to be doing this with you. We have lots of great conversations, you and I, about addiction, codependency, and grief. And we'll touch on some of that today. And we have many more podcasts that we are going to do together. But as Frances and I have talked over recent months about, really what our goals were for this is, at least from my perception, it's we really want to make a lot of these concepts that can be confusing and difficult, and people can kind of get stuck in. We like making things easy and easy to understand and relatable and doable, and having recovery from anything be something that we all can take part in. And so we're just going to talk today and hopefully be helpful around what codependency is, how it shows up, some good resources, where it comes from, and maybe even a little bit of a conversation about what does that codependency work and recovery look like. So, yay, Frances. I'm so glad that we're here together. Thank you for being here. Tell us a little bit about yourself.
Yes, thank you very much, Sophia. Good morning to you and good evening to everybody from here in Northern Europe. Uh, Thank you for the warm introduction. My field of expertise has been, I've worked as a holistic body therapist since 1997 with a special focus on addiction, and I work also as a practitioner of shamanism, which is a field where really we need to discuss furthermore this discussion about codependency. There's a term in shamanism called soul loss, which refers to parts or pieces of the soul that break off or that split off during traumatic experiences, and typically they spontaneously come back. But when the trauma is prolonged and long term, quite often they stay away, and that can lead to a loss. This loss that we talk about that creates the emptiness. So inside the person, the victim. So this is an area that I've been working with over 20 years. So it's great to have this space and opportunity to talk something about this with you today, Sophia.
Yeah, it really is. Boy, I just learned something new about you. So I can't wait to talk to you offline about that. So that's exciting for me. Um, yeah, I enjoy our conversations that we have, Frances, because um, you have done so much personal and professional work that, not only am I always learning something from you, but you have great insight, and that's really helpful for me, being that I work and focus in this area as well. And so, but at the same time, we have very real conversations that are not on these huge, difficult intellectual, academic levels. I mean, sure, we can do that if we want to, but we're real people together. And I think that's going to really be helpful to anybody who's listening. Um, so I know one thing we love talking about is codependency. And I'm gonna like start with a very quick spiel, and then I want you to, always jump in and add. But I facilitate a meeting on a website called In the Rooms, called Codependency, Grief, and Relationships. And I have a pretty quick spiel about codependency because there is a lot out there about codependency, all good stuff. But it's really an area that has grown and morphed and changed over the years, and it's been a few decades now. Um, Also, I just want to name sometimes codependency gets a bad rap, depending on where you are and who you're talking to and what the setting is. But just to kind of give a very, global overview, codependency started out a few decades ago in the area of addiction and specifically alcoholism, where there was, very, very stereotypically a husband male alcoholic and a wife female who was controlling or enabling. And so these behaviors, kind of played off each other. And the term codependency really came about. And that codependency being that when this person was in their active alcoholism, it created this really unhealthy codependency with the alcoholic that looked like, crazy making behavior is what it's been called, of taking the alcohol and pouring it down the sink and then, like, throwing everything away or covering up when they're drinking and driving, or when they can't go to work, to call in work and say that they've got the flu, or making excuses, with the kids or with family or with neighbors. So, while the wife was, doing all that work for the family basically, and for this person who she loves, um, it was creating so much pain that, again, a lot of very unhealthy behaviors would start, and that were also very obvious. So while she was covering up his poor behavior, her poor behaviors were obvious. And so, codependency really started in that place. And really it has morphed and changed to be more of, there can be emotional codependency with no addictions present at all. And that can be where we have too much closeness or enmeshment. Also, codependency can grow into something called love addiction, which is, I call codependency on steroids. So it makes codependency look like nothing. And it's like, "Wah." I mean, it's like this big, big thing. Um, so it's changed over the years. The literature around it has changed. Some people really like the work of codependency. Some people don't. Sometimes codependency has been called co-addiction. That did not go over well for a lot of people, so we don't really say that anymore. Um, but at the end of the day, there's good stuff out there. I encourage people to read books. There's also coda.org. Codependence Anonymous has a website, and there's amazing resources that really make codependency easy to understand. There's this document called Patterns and Characteristics. There's another document that I love called, like, Codependency and Recovery, or Recovery and Codependency. It really kind of maps out information. And for me, I like to take everything and synthesize it so that I can understand. Um, Also, being that I have been working in my own codependency recovery since I was 15, I'm almost 54 in less than a week. So this is an area that's very near and dear to me personally and professionally. Um, that when I look at everything, there's really no definition of codependency, which is also hard, and has been difficult over the years. And I've come up with a modern definition of codependency, which is the obsessive focus outside of ourselves on other people, places, or things. And we're seeking validation and affirmation when we are in a codependent place, but we're seeking it from other people because we never learned how to do that ourselves. And codependency is really born in very early childhood, which we're gonna touch on today. So whenever we look at all the different kinds of codependency, denial patterns, controlling patterns, avoidance, or enmeshment, we're focused out here. And when we're focused out here on the other person or on the other things, we're abandoning the self, and we're not taking care of ourselves. So for me, that's just an easier way to think about codependency. It's less about the other person. It's less about the relationship. It's more about how we focus out here and how we abandon ourselves. So that's my take on codependency as far as what it is. And Francis, what would you add to that?
Yeah, thanks. There's some really good descriptions there, Sophia, and I can relate my understandings also. And I loved this kind of way you described really like Melody Beattie's work about that core, that stereotypical model of, the alcoholic male partner or father or whoever, and the wife as the co-addict, codependent, and surprisingly, because of this kind of development of research into it, a far greater understanding. And what I'd like to add to that, if I may, is that in my work, looking at codependency having its origins in relational trauma from childhood, whereby there's trauma in terms of abuse. It could be physical abuse, it could be sexual abuse, it could be spiritual abuse, it could be, religious control, but somehow the children don't get what they need, and so that then creates problems with the self-esteem. It creates problems with um, relationships, how to communicate to other people. People tend to go into hiding. They might hide in food or in avoiding people, because being around can be so stressful if they've and of course this is how children end up with like PTSD, which is quite often undiagnosed because they're so young. When we talk about PTSD, we think more about soldiers and veterans and people who are victims of violence, but it's also a common problem in children, and they quite often, I think, it can be misunderstood or even, dare I say, misdiagnosed as some other issue, when in actual fact it can be a response to very abnormal circumstances and situations. And another thing was quite interesting. I was talking to somebody recently, a woman who'd had quite a good childhood. The parents were together, but then she got together with an alcoholic, and after living with this alcoholic, she became very codependent as an adult person. And it fits in some way the description of what you started off with, this idea. And I thought that's very interesting. So, one of the ways that an information understanding has developed for me is understanding that codependency can happen to anybody at any age, but predominantly children are always at the greater risk because they're developing as children. They're developing themselves, and they're growing and changing. And while they're in that, they're incredibly vulnerable to being exposed to these to extreme circumstances. And so, as a consequence, that is one of the most common setups for addiction.
Yeah, 100%, Francis. Thank you for that. Yes, codependency is absolutely foundational to addiction. I think that the field of addiction research and treatment and the practice in addiction would better serve our field and our clients if we were regularly discussing like really what codependency is, not what the stereotype and
Mm.
what we've heard negative about codependency, but just to really drill this down even more and piggyback on what you said, we are all codependent in some way. Everyone on the planet learns how to be codependent because it's in our pre-verbal, pre-memory years when we are dependent on our caregivers, whoever our caregivers are. Our caregivers can't possibly give us everything we need at every second of the day. So as very small young beings, we learn to focus out here to get our needs met. Now, why do I get fed sometimes when I'm hungry, and then sometimes when I'm crying, nobody comes to me? Why am I wet sometimes and sometimes I'm not wet, and they make me dry? So like, we're confused, we're little, we're not really talking like that, like I just said, but we're kind of like experiencing the world. But what we're learning, it's appropriate when we're little that we get our needs met from people who are supposed to be responsible, right? So even in families or in young people's lives where there's no abuse, there's no trauma, we still learn how to be codependent because we learn to put our focus out here about, can you please come meet my needs? Can you please come help me? Can you please come meet my needs? And, at appropriate times in our little lives, our caregivers are supposed to guide us into learning how to go to the bathroom so that we can make ourselves dry and comfortable, right? How to go and get some kind of snack that's safe, instead of waiting and I'm starved. And so, but a lot of us don't get really good, healthy parenting. And even some of us who do, when we get less attention, even, and another sibling is born, we're getting less. And so we're still looking like, why am I not getting enough? We still learn how to be codependent because we're looking out here like, why are you not meeting my needs anymore? So I really want to normalize codependency. It's a universal construct and experience because on some level, all of us, when we're little, we don't get all of our needs met. It's born out of what we did not get around care, comfort, safety, nurturing, and affection. Some of us, like what you're describing, didn't get a lot. And in fact, we got a lot of abuse and experienced trauma. That's the extreme. And then there's this whole continuum. And over here, it's this more benign emotional neglect that really is very hard to see when someone grows up in a normal family, but it's still present. And so, I just want to normalize codependency. It's something we all learn, and it's not a bad thing. I mean, can it be dangerous? Can it be bad? Can it get toxic? Yes. But we can unlearn that, and we unlearn that by the recovery process of learning how to care for ourselves and meet our own needs. And then whatever affirmation and validation we get from others is like icing on the cake.
Yeah, thanks a lot again for a really good description there. And I love this idea of normalizing it, because once it's normalized, we can talk. We don't have to feel ashamed or embarrassed about saying, hey, I've got some issues around codependency, and this is possibly where they originated from. When you were talking there, I was thinking about your practice that you run in Sophia, the psychotherapy practice. And also, when I lived in the capital, Helsinki, I ran a clinic there for 5 years. And it was predominantly working with, in any capital city, the work's going to be hard. It was really frontline work. And I can remember, and I found this also commonplace. I think this great term that's been coined, adult child, is a very good concept that describes in many ways this codependency, because underneath it, I mentioned earlier about, if there's trauma in the family, which kind of stifles the self-esteem. It stifles the emotional immaturity, that the children can't develop emotionally. They can't become emotionally mature. So they stay as immature adults. And, I've worked with people from, let's say, 12-step groups, AA, NA, OA, ACA, CODA, and it seems to be that there's this kind of common denominator amongst everybody where many talk about, I feel like inside, like I'm emotionally immature. I struggle to, be a father or a mother, and I struggle with adult relationships, being financially responsible, being responsible in any ways. And I think, that one of these discoveries that we talked about, or the progress that's been made in this field about that emotional immaturity, is a real core issue that I wanted also just to bring in to what you were saying there about that, and understanding how, when that emotional development gets impacted by alcoholism, drug addiction in childhood, or gambling, or it might be a parent who's died, or it might be a parent who's, I've heard you mention before about mental illness, in families that people can be impacted, children can be impacted by that, and then they don't get their needs are not met, as you were saying, and then how that really then impacts the self-esteem, and that combined with a lack of emotional development and growth is like one of the massive contributing factors to how people become codependent, you know. So
Yeah, yeah, absolutely. You know, codependency, like many things, it's something that we learn, ages 0 to 3, pre-memory, pre-verbal, and it may not actually blow up until we're older, like you were describing it. I mean, certainly, once we learn about it, we can kind of look back and go, oh yeah, that was a type of codependency that I was taught. It wasn't wreaking havoc in my life at the time. It was affecting me, so I understand it. And then a certain relationship can really, trigger like a big activating reaction that can really turn into something else. And so um, for those of us in codependency recovery, it's something that we have to really always pay attention to. And because it can rear its head at any time, depending on, how we're feeling, or, what we're engaged in with another, and who that person reminds us of, because everything is kind of, stored in our brain and in our nervous system. But I do also want to highlight that, since we learn how to be codependent early, and feeling the feeling of codependency is usually a really crappy feeling. Like, it leaves us feeling scared, alone, sad, less than, not adequate, we don't matter, not okay, like however you want to name that. And when we're younger and we feel that a lot, like you were talking about, we're going to find ways to self-soothe, usually in unhealthy ways, because again, most of our caregivers didn't know how to teach us how to soothe in a healthy way. So we have to learn these things as adults, in our kinds of personal work and recovery. But, ways that we self-soothe when we're younger, food is one of the first ways. That, oh, you're crying, here, have a bottle, be quiet. And so we learn that. This is like ages 0 to 3, we're already learning that. Food's a big one, sugar is a big one, these are like kind of the more benign ways to self-soothe. Gaming is another one. Now we have young people looking at pornography online, starting from, like, could be the ages of 5, very, very young. And we're still feeling that, we might be having these ways to self-soothe, but everything's kind of feeling worse, getting worse. And so it's really not hard, at least for me, to understand how addiction might come into the picture, because addiction is really just a response to feeling bad and not knowing how to self-soothe in a healthy way. Nobody wakes up one day and is like, you know what? I'm going to become an addict today. I mean, it's like something that accidentally happens because we feel shitty.
yeah,
And we feel shitty because we're looking out here for people to meet our needs. Nobody's there, and nobody's doing what they need to be doing, and we don't know how to do it. And so, I might start drinking because it helps me feel less anxious.
yeah,
And I might start smoking pot because that helps me feel a little more numb and less anxious. Or, when I look at porn and then I hook up with people through an app, I get to numb out the feeling of not being wanted. And over time, that easily becomes an addiction. And what's foundational, again, is that codependency of, we're constantly looking outside for something else to help us feel better, because we weren't taught how to do
mm.
that, in an effective way from our caregivers.
Yeah, great. I'm really glad you mentioned that about porn because it's like an epidemic. I don't know what it's like in the US, but
Oh, yeah.
over here, yeah, I guess it's quite similar. Over here in Europe, it's a major problem. And that when people didn't get, when children didn't get that male or female energy, that parenting energy, that time, attention, and direction, then they go looking for it in all the unhealthy places, as you mentioned. And I've been working with some young teenagers over this last couple of years exactly around this issue. It's always done in secrecy, you
Mhm.
know. There's always something kind of under there that how they feel about themselves. And I think also one of the other things that kind of enables codependency, Sophia, is especially for a lot of men, and I guess the same for women, is this unhealthy bonding. There's like this, if that bonding hasn't been happening in a healthy, nurturing way, as you mentioned in childhood, then these vices kind of fit right into that void, that empty space that's in there because the course, the core hasn't developed, it hasn't become whole, it's fragmented or it's empty or whatever situation it's in. And so one of the ways that they bond is through vices, and I've only to think about drinking, amongst these young guys and young girls as well, but predominantly around young men. It's like this whole initiation into adulthood is based on how much you can drink, and how much trouble you can get into and what you can do. And really, there's always consequences for that. If not for the person who's acting out, or then for the other people, drink driving, and some people have accidents and fatalities. And then there's of course the use of alcohol in an extreme way tends to bring trouble with it, violence and criminality and other ways of other consequences that are there. And so it was really good to hear what you said about that, because they when they and what I wanted to also talk a little bit about today and try and direct some of this energy is towards young people, because
Yeah.
they come into life, if they haven't had a good childhood or whatever, or the parents have not been giving them what they need, or there's been illness in the family, they kind of get set up for acting some of that stuff out as teenagers and then adults, and they really don't understand what they're doing, except when they're in the probation office or they're in the accident emergency or the police custody, or drinking, driving, or whatever it is, getting into trouble. And I was thinking that just being able to say that it's really evident also in teenage years, in kids. Sometimes they're acting out at school, and the teachers don't see it as this what's in the family home. It's like the processes on the problematic child, but quite often they don't look at they may not see for clearly the family background, and so one of the things that I've learned to do is when I work with people, and I know you have something similar, is where it's possible is to try and get the whole family involved in discussing this. But of course, a lot of families are not open, because it's like, we're not going to talk about our secrets and get, air the dirty laundry, etc. So it can be quite difficult. And it's why that a lot of people sometimes find they have to move away from their families in order to start doing the work of recovery, so that they can break the enmeshment and or if they're in a role, a codependent role, or a scapegoat, or whatever it is, they can somehow get away with that, get away from that, and then hopefully seek therapy, or else 12-step meetings and groups tend to be a really good place, a very common place where people can go that do need reaching out. And one of the good things, of course, is it's free.
Mhm.
These groups are free. So
Yeah, all good stuff, Francis. Just to piggyback on that, and then we'll talk about a few more ways to work on codependency. You mentioned connection, social connection. Yeah, addiction is definitely, a lot of it is created around that social connection. And when we're talking about how codependency is created, when it's about looking at what we did not get, and if we didn't get all of these things, the obvious piece that we're not getting is healthy attachment. with our caregivers. So that sets us up, and this will be a whole nother podcast or two, that sets us up for a lifetime of not knowing how to connect healthily and not knowing how to have these social bonds that are healthy and helpful. And, we know through neuroscience research, which is amazing, that when we activate the social bonding neural pathway enough, we have less grief, less fear, less loneliness, less anxiety, less depression. And also, addiction happens less of the time. When we don't have healthy relationships, it's highly likely that someone is going to become an addict. And,
Yeah.
and again, that's not me saying that. That's like proven through neuroscience research. So that's hugely important to hear at any age. And I guess let's just finish up with, you've mentioned 12 step, which is, I love that it's free. It's available all over the world. I mean, that's a benefit, from COVID, is that there's more online and telephone groups of all kinds. There's a 12-step group for anything you can think of under the sun. It exists. And if you don't see it, you can
I think
start.
there's 200, about 200 last time
I
I
mean,
was inquiring. Remarkable.
it's amazing.
Yeah.
And 12 step is great. And one of the reasons why 12 step works is exactly from what we were just talking about. It's that social bonding. Yes, the steps are helpful. Yes, that's all good, but it's really the connection that is learned, that is safe, and having acceptance around what we struggle with is really why 12 step is helpful. So if you want to work on codependency, you're interested in kind of diving into this and seeing how codependency presents in your life, I would say look up coda.org. Find a therapist who, if you can, who knows about codependency, knows it well. Read a lot of books. There's a lot of great resources. Also, come and join our codependency, grief, and relationships meeting every Wednesday at noon Eastern on the website intherooms.com. That's a great website with lots of resources. But there's a lot of good stuff out there, lots of good workbooks. And the work of codependency is so freeing, and the benefits of it are learning how to be responsible for ourselves emotionally, physically, mentally, so that when we are more connected, taking care of ourselves, we're actually calling in healthier people into our lives, and then those relationships are more healthy in that social bonding, and that social bonding neural pathway in the brain is getting activated, so we feel better, our relationships are healthier, and we're living a happier life. And it's really nice to be able to learn how to validate and affirm ourselves. And so whenever I get a compliment or someone says, "Oh, Sophia, you did a great job with this, thank you so much," like, I can take it in and I feel it, but I've already given that to me. Even if they say, "Sophia, you did a shitty job, I'm never coming to you again as a therapist," I'll be like, "Okay, well, we're just not a good match." I'm not gonna like take it in and believe I'm a shitty person. And so that's the benefit of codependency work, is just really it's the gift that keeps on giving.
Yeah. Yeah, it's really valuable work. And I'd like to also add there's a coda.co.uk website also as well for people in the UK and also around Europe. I think maybe you can find it on the coda.org website there as well. And also there's some really good resources, as we know, on YouTube, in addition to what we're talking about. I don't know if you want to mention some of those or not, but there's some really good stuff you can find. Pia Melody and John Bradshaw. I think is it Benny Brown or Benty Brown? I can't. Uh,
Brene Brown.
Renee Brown. Yeah,
Yeah.
I know she's somebody nowadays, but more recently who's taken this. But I think Pia Melody's work is really
Yeah.
amazing, because she worked in a treatment facility, so she knows the problem from the. I think she's retired now. I don't know, but but she really identified from the problem inside out. And there's some really good lectures of hers as well. And I think she had some books published also.
She does. Facing Codependency is a great book by Pia Melody, but there's a lot of good ones out there. Yeah, there's a lot of good resources. Thank you, Frances. This has been lovely. And I look forward to our next podcast. Thank you so much for joining me today and to sharing your wealth of knowledge about these topics.
Thank you a lot, Sophia, and I'll see you next time.